My name is Lorelai, and I am a mother of another child with Tay-Sachs named Isaac. Today I have Eli. Eli is 8 years old with Tay-Sachs, and he is going to demonstrate the chest vest for us. A chest vest is something that can provide manual percussive therapy to a child who is not up and running as much. The reason to do some manual chest percussion or chest percussion with the vest is to provide that additional mobility to the lungs. If we're not up and running around, we might not be inflating our lungs as big. We might need a little help coughing up extra secretions. We might need a little help anytime we have a cold or anything more than that. But we can also use it for prevention, like on a daily basis. So, are you ready to have a little shake time? So we can joke about shaking the baby. This is the one time that it's okay to shake our kids, huh? Shake them up a little bit. So there are different options for chest vest. This is a Hillrom called the Vest. There's also Smart Vest. There's 2 or 3 main components here to it. You have a machine that actually pumps air. So it's doing that both on a frequency, so how fast are we shaking, and then intensity, how much intensity. Some children, especially younger ones, they might not be able to sustain as much of an intensity. The actual settings for your machine should be worked on, either provided to you by your physician or they should be provided to you by your respiratory therapist. And that should come to you when your machine comes to you and is set up. Then you have hoses that actually pump the air to a vest. Eli today is wearing for us a wrap instead of a full vest. There's vest options that go up and over our shoulders and can pump the air all the way around. This wrap option is really going to just pump in the front, huh? Do you want to see the camera? Are you going to let us see? Let's turn. Are you going to spin? Spin. Nice job. So then we can plug the hoses in, and some of the vest options only have one hose. Still doing the same thing here. And then we can just go ahead and press on. So this one is starting to, you can hear the air starting up. Thank you. Oh, there we go. All right, and so then your person who's getting therapy can still do their regular activities. We can still play with some toys. Or if your family member, your child needs some nebulizer treatments, they could be receiving a nebulizer treatment. A nebulizer treatment, it might be a type of a medication aerosolized through a mask or a hose that they can breathe straight in while they're getting their lung treatment, their vest treatment. Oh, is that funny? You know that it's providing some benefit if they can talk or sing to you, and you can hear a difference in their voice, because it would be the same thing. Is that funny? Does it tickle a little bit? You can see Eli has a little bit of a shake to him. That's perfect. So that's providing some good benefit to those lungs. So for Eli, he's able to sit upright the whole time that he's doing it. But some people, maybe in order to spit out some more of their secretions, benefit from moving during a treatment. So for us at home, we have it set up for 3 6-minute cycles, and so it'll pause at 6 minutes. And I can ask Isaac to just turn on. Eli, I'm going to have you pretend to be my Isaac. Roll onto your side. I know. He's like, I don't know about this. And then if I have him in a side-lying position, this is providing a little different option. He's like, no, thank you. A little different option to where he can spit out secretions to bring them up. Because you think about how deep your lungs go and there's different spaces to your lungs. So if you're able to lay on one side for a few minutes of the treatment, turn to the other side. For some of the kids, we can even put them on their stomach, rolled over a pillow. Eli was demonstrating that nicely, and it allows you to be able to spit out those secretions while you're getting your vest treatment. So for Isaac, I like to roll him on from one side, then onto his left side, and then onto his stomach. On his stomach, this allows him, if he's going to cough up any secretions, like if he's doing it while he's sick, then he can, immediately spit them out. I have seen some people, and I've had some nurses do a vest treatment straight on somebody's back. That doesn't seem like it makes a lot of sense. If you do start to cough and you're laying straight back and this vest is doing a great job of bringing it up, then you're just at risk of aspirating right back down into your lungs. So I do encourage you to at least provide some tilt to the body when doing a vest treatment. Should we change positions while we're in the vest treatment? It would be beneficial. If your child can tolerate changing positions in the bed, again, you can set it up for various cycles with your respiratory therapist or your physician, and that allows those different lung fields that option to really start bringing and mobilizing everything up and out of those lungs. Some people are getting suctioning, and if your child happens to bring up some secretions during the chest vest treatment, this is what you were hoping for, there might be a question of whether or not to suction during that. For most kids, you want to pause at suction, but some kids, the intensity isn't high enough, and they brought it right to the forward of the mouth. Very easy to go ahead and just grab it while the vest treatment continues. Of course, if your child is tolerating a higher frequency, so more shaking, and the secretions are further back in the throat, you're going to worry about hurting them while they're shaking and you're trying to suction them. So a vest treatment is a great treatment option for all ages. So of course they make vests in small sizes for our little ones, but you see originally the vest treatments, I believe, came up for cystic fibrosis, so lung diseases. But some of these people do live into their 20s and 30s. So anybody who has issues with mobility can benefit from a chest vest therapy machine. And some of the reasons why you would start to include this in your, arsenal of treatment options is a couple of pneumonia bouts, multiple colds, suctioning more frequently but not able to get those secretions up. So then you're just suctioning saliva, but you know that's kind of sitting in there. If you're able to advocate for it and get it, like if you know the direction of your disease process and you know that this is something that's going to be coming for you down the road, and you can work with your pulmonologist or your regular pediatrician and get it in the home beforehand, then maybe you can prevent going in the hospital for pneumonia for a lot longer. We started it before we ever had pneumonia in the home. And and we had to advocate though. It's like, oh, he's never been sick with pneumonia. He's never been hospitalized. We had to say, yeah, we don't want him to be sick with pneumonia. He's already had multiple colds, and we're having to already do manual chest physiotherapy to help him excrete and turning him on our lap. And he's getting heavier and heavier. It would be great to have a machine to help us instead of us trying to manually turn him. Another side benefit of a chest vest, so we're helping the respiratory system until you know your child and you know what they're potentially going to do. It would be beneficial to have a chucks pad under them because sometimes it helps shake up the GI tract as well and cause some mobility and some filled diapers. It's not necessarily a great idea to do a chest vest treatment while a child's on a feeding if they are fed by G-tube. Obviously, we're not trying to drink. Are you getting a massage now? Yeah. If they're not necessarily trying to drink by mouth while getting a vest treatment either, but definitely during a G tube or GJ tube feeding, paying attention to them. I have seen some people, if they're sitting upright, they can get away with it, especially if they have a fundoplication. But if they don't have a fundoplication, you want to wait at least a half hour, depending on digestion. Allow that food to move on before starting a vest treatment. With regards to maintaining your machine for your vest treatments, you can keep it well dusted, put it away when it's not in use. Make sure that the connections aren't getting too dusty or gunked up with pet hair or anything like that. The hoses themselves internally, they shouldn't be getting any fluid or anything in them because they're just pumping air. The vest itself, once in a while, it might get some bodily secretions on it. It's not recommended to put it in the washer though because of the fittings, but you can hand wash it, and it's going to be to your benefit to go ahead and hand wash it right away. When would you potentially need to replace parts of your machine? So obviously you're going to have the company or an RT come out if it just won't turn on and you've already checked and it's plugged in. Your hoses, if for some reason your hose actually became cracked, you're going to be leaking air directly from the hose. Your vest or your wrap, you might be able to feel some air coming from around it even early on, and it's these micro pulses that depending on the intensity of air, that air does have to go somewhere besides just shaking the child. If at any point though you don't see the child shaking anymore, or the air is, you actually see openings in the vest, then obviously the vest or the wrap is not going to be able to be beneficial to you. Or you also can replace it when they outgrow it. They do, because most of them are Velcro. They do last for a good amount of time, but yes, if they are not able to connect and cover the chest, then that's not going to provide any kind of benefits.